Hello, this is Dr. Pauline Lucas. Welcome to session 1 of the series Nurturing the Body, Mindfulness and Meditation for Physical Healing. I am really excited that you chose to join me in meditation today. Each session in this series will start with about 5 minutes of me sharing some insights related to mindfulness and physical health and healing, and will be followed by 15 or 20-minute guided meditation practice. By following this format, it will be easy for you to repeat just a meditation for a few days without needing to listen to the instructions repeatedly. You just fast forward to the 5 minutes mark and start with the meditation. It's ideal if you can find a quiet place where you will not be disturbed and where you can be in a comfortable position. Make sure you put your phone on silent mode. I also encourage you to have a journal and a pen close by, so you can either pause the recording during the talking part and journal some insights, or do this at the end, but not during the meditation. If you prefer to write on an electronic device, make sure to close all other apps and turn off any notifications so you will not be distracted. Today I'd like to start by acknowledging that you may have chosen this session because you're dealing with health issues, or you're in pain, you're stressed out, you feel tired, or disconnected from your body. And I really want to say I'm sorry that this is how you're feeling, but I also want to assure you that you came to the right place and that I'm here to support you on your journey to feeling better. And although we're not physically in the same space right now, if you were my patient and you would be sitting with me in my exam room, I would ask you, what brings you here? How can I help you? And what would be the ideal outcome of our time together? As a health coach, I've learned that the clearer we are about our why when we start a new practice, the more likely we are to stick with the program and achieve the benefits. Maybe take a moment right now and pause this recording to think about the answers to these questions for yourself. And perhaps take a few notes. What brings you here? How can I help you? And what would be the ideal outcome of our time together? In order to get to understand my patient's needs even more, I ask them more questions, more specifically about their experience, like, how are you feeling right now? What's your energy level? How does your body feel? And if there's pain, I ask them exactly where the pain is located and what it feels like and what makes it worse or better. Often my patients look at me with a sense of surprise, like they haven't really paid that close attention to the details. How about you? Would you be able to answer these questions? Again, if you wish to write a few notes, just pause the recording and come back for the guided meditation when you're done. The first visit is often also the time that I introduce my patients and clients to the body scan meditation. It's a simple yet powerful practice that helps us to become more connected with how we feel, which is really an important starting point when we aim to be more comfortable in our body. With awareness there comes choice, says author Eckhart Tolle. And I've also heard the expression, you gotta feel to heal. When we become aware, for example, that we're chronically tense in our neck and jaw muscles, we can learn to consciously relax them. And like many of my patients, reduce or even eliminate chronic neck pain and headaches. So how about today we get started with a body scan practice? It's a simple practice that I will guide you through and that you can do every day if you like. So find a very comfortable position where you will not be disturbed. For some of you that might be sitting up, which is ideal because it will make sure that you don't fall asleep. But if that's too uncomfortable for you, you can do this practice lying down on your back or on your side. So simply get comfortable. Have any props ready that you need, maybe a pillow under your legs or a pillow behind your back. Or I often like to sit with a pillow on my lap when I'm sitting upright, just to support my arms so my shoulders can relax. Make sure you're not too cold, not too warm, and let's get started. Let's take 3 long, calm breaths, ideally in and out through the nose, filling the whole chest and belly with air on the in-breath and fully letting go on the out-breath. And at the end of the 3 breaths, allow your breath to resume its natural pace and rhythm. Then become aware of any sounds around you. Sounds in the room you're in, sounds from the building you're in, perhaps even sounds from your own body, your breath, or your digestive system. Allow those sounds to come to your ears naturally. No need to try and figure out what they are or where they come from. And then releasing the attention to the sounds around you. We're going to start to scan the body from the top of the head all the way down to the toes, and I will guide you. Let's start by bringing gentle attention to the top of the head. Noticing what sensations might be present. Warmth, coolness, pressure, tingling. Any sensations, simply notice. No need to analyze. And if you don't have any sensations in certain parts of the body, then simply accept that. Then bring the awareness to the forehead. If you find any unnecessary tension, allow to let it go. And if you can't let it go, then simply accept that there's tension. And then feeling the eyes. Ideally, the eyes are closed or slightly opened. And if they are closed, make sure that the eyelids are soft. The eyelids are as light as the wings of butterflies, very softly closing. And then feeling the jaw. Allow a little space between top and bottom teeth. Jaw muscles soft. And then feeling the inside of the mouth. Tongue relaxed. And become aware of the space inside the mouth. What sensations are present? And then noticing the neck, the back of the neck, and the front. What sensations are present there? Perhaps clothing, touching. Perhaps you can feel sensations of movement as a result of your breathing. Notice temperature. Any other sensations? And again, if you feel that there's tension, are you able to release the tension and soften this area? And if not, can you allow yourself to simply accept the tension that you feel? And even notice what tension feels like. And then becoming aware of the right shoulder. And again, without any judgment, noticing the sensations in the shoulder. And then the right upper arm, elbow, forearm, and the hand. Are you able to feel all the fingers of the right hand? Thumb, index finger, middle finger, ring finger, and pinky. And then feel the entire right arm from shoulder to fingertips. Then releasing the attention from the right arm, let's move to the left side, feeling the left shoulder. The left upper arm, the elbow, the forearm, and the hand. Again, noticing all the different fingers. The thumb, index finger, the middle finger, the ring finger, and the pinky. Then feeling the entire left arm from shoulder to fingertips. And then feeling both arms from shoulders to fingertips. Then moving the awareness to the spine all the way from the top of the neck down to the tailbone. If you're sitting, you might feel the back resting against the backrest of your chair or your pillow. If you're lying down, you might feel where your back is supported by your mat or your mattress. Can you feel where your spine is actually connecting with the surface behind you, and where there's perhaps a little space between your back and the surface you're resting on? And what are the sensations that you're feeling in your neck, your upper back, and your lower back? Is there warmth or coolness, lightness or heaviness? Are there any other sensations like clothing touching? And perhaps you can feel a rhythmical movement caused by your breathing. Are you feeling a sense of constriction or ease and flow? Again, no judgment, simply noticing. And then becoming aware of the front of the body, the chest and the abdomen. In this area, you might be more aware of the sensation of expansion and contraction as a result of your breathing. And notice any other sensations present. Avoid labeling them as good or bad. See if you can just notice them more objectively. Sensations are just information. Then now bring the attention to your right leg, starting at your right hip, noticing buttock, side of the hip and front of the hip. Noticing the right thigh, front and back. You might feel where your buttock and your thigh are resting on your chair or your bed. And feeling the right knee, your lower leg, front and back, your right ankle, and then all the way down to your heel, your foot, and all your toes. And then feeling the whole leg from hip to tips of toes. Then moving the awareness to the left side. Left buttock, side of the hip, and front of the hip. Left thigh, front and back. Noticing the various sensations that are present. Your left knee, your lower leg, ankle, heel, foot, and all 5 toes. And then becoming aware of both legs at the same time, hips all the way down to the tips of the toes. And then notice if you can feel your entire body at the same time, from the top of the head to the tips of the fingers to the tips of the toes, whole body. Whole body resting, whole body breathing. And then allow yourself to take one longer breath and a full out breath. And bring some movement in your fingers and your toes. Maybe opening your fingers and then making a fist. Maybe rolling your ankles. And then maybe stretch your whole body out a little bit in a way that feels like you're waking up from a long, delicious nap. Just stretching out and taking a few more deep breaths. And then depending on your timing and schedule, maybe this is the time to actually take a little nap. Or if it's time for you to get up and go about your day, perhaps do a little more stretching, a little yawning, and then slowly make your way up and go about your day. Thank you so much for meditating with me today, and I'm looking forward to our next time.